So today I'm going to talk about diabetes mellitus, which is one of a very common disease, and I'll talk about the statistics associated with it. So what is diabetes? It's basically a disease in which your body either doesn't produce enough insulin or it's producing a lot of insulin, but your body cells become resistant to this insulin. So there are a couple of mechanisms how diabetes is caused. As I said, it could be insulin production, regulation, secretion, or beta cell damage. So insulin is a hormone that is produced by pancreas in the body. So pancreas is one of the organs in our body which makes insulin, and you need insulin to utilize glucose. Every time we eat, the food is metabolized into sugar, which is absorbed into the bloodstream, and then it is used as fuel for all the different, the cellular level, all the functions that we perform. So if that glucose stays in the blood and doesn't go into the cells, it's quite useless and it causes high glucose in the blood, and that's what diabetes is. How many types of diabetes? Generally speaking, we classify diabetes as type 1 and type 2 diabetes. Type 1 diabetes usually affects younger people less than 40 years of age, and in this there is a defect at the pancreatic level and the body quit making insulin. Type 2 diabetes affect mostly people above age 40. There's not enough insulin production like we see in type 1 diabetes, or your body is still making a lot of insulin, but you require way more than what your pancreas is making. So what are the symptoms of diabetes? Most common symptoms are blurry vision, excess thirst, fatigue, frequent urination, weight loss. I'm going to talk a little bit about how diabetes impact us as a society. 8.3% of our population, US population, is diabetic, and it's almost 26 million people. How do we screen for diabetes? It's a very simple test, fasting blood glucose. Most of us, when we go to our primary care doctors, we get yearly health blood work, and it is a part of that. If your blood glucose on a fasting sample is above 100, that signals us that you have either prediabetes or impaired fasting glucose. But if it is above 126 twice, then you're labeled as diabetic.